Good morning, my name is Shalina Johnson, and I will be presenting on case study 2. So, I will be talking about the case study. What is coronavirus? Symptoms, transmission. What is a chief medical officer? General role of a chief medical officer. Investigation of the case. Control and prevention. Resolution of the case study. On December 31st, 2019, China reported a cluster of cases of pneumonia in people associated with the human seafood wholesale market in Wuhan, Hubei province. On January 7, 2020, Chinese health authorities confirmed that this cluster was associated with a novel coronavirus, COVID-19 29. All the cases were originally reported to be associated with exposed to the seafood market in Wuhan. Current epidemiological data indicated that person-to-person transmission of 2019 coronavirus is occurred. As of January 30th, 2020, a total of 9,976 cases has been reported in at least 21 countries, including the first confirmed case of COVID-2019 infection in the United States. Reported on January 20th, 2020, as of April 24th, over 2.7 million cases have been confirmed, with over 194,000 deaths across 185 countries. As of June 5th, over 6.75 million cases have been confirmed, with over 393,000 deaths across 210 countries. What is coronavirus? A coronavirus is a kind of common virus that causes an infection in your nose, sinuses, or upper corona. COVID-19 is a disease caused by SARS-CoV-2 that can trigger what doctors call a respiratory tract infection. Symptoms. People with COVID-19 have a wide range of symptoms, ranging from anywhere between mild to severe or very severe. Basically, the symptoms appear anywhere between 2 to 14 days after exposure of the virus. Below, I would aforemention some of these symptoms, although all is not presented here. Fevers or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle aches, headaches, loss of taste and smell, sore throat, congestion or runny nose, nausea or vomiting, diarrhea. Transmission of coronavirus. COVID-19 spreads when an infected persons breathe out droplets or very small particles that contain the virus. These droplets and particles can be breathed by other persons or land on their eyes, nose, or mouth. In some circumstances, they may contaminate surfaces by touching. People who are closer than 6 feet from the infected persons are more likely to get infected. What is a chief medical officer? Is someone who oversees one location and other manage multiple clinics or hospitals. They often negotiate with insurance providers, laboratories, medical supplies providers, and other organizations. They also make sure that doctors and other medical professionals detailed accurate records and comply with local and provincial laws. Chief medical officers will also help hospitals or healthcare companies, board members decide when to renovate, expand, or add new medical equipment. My general rule as a medical officer: authorizing large purchases, overseeing audits and accounting records and managing budgets, reading performance reviews and deciding which employees to promote, scheduling maintenance and repairs for the buildings and medical devices, maintaining medical inventory by ordering new supplies and equipment as needed, complying with the hospital or clinic budget, and finding ways to cut costs when possible, making regular verbal or written reports to owners or executives. So, my role in the investigation of the case. As Chief Medical Officer, my role in the investigative process of coronavirus is to ensure there is sufficient medical protective wear and medical testing supplies. These are important to protect my workers and to prevent possible transmission. Providing training for my medical staff for testing of the public, whether in the clinic and hospital. Here, the training is necessary because without the training, there can be fast transmission of the virus, which can eventually cause an epidemic or endemic of this virus within the society. And this will cause a grave problem on the economic and health of the society and country, and also by community outreach testing sites. This is important because we get the opportunity to go there and test people in this community, give them the diagnosis, and also treat and give vaccinations. This role is immensely important because I provide the testing basis for this virus for the confidentiality and safetyness of all workers and patients. Here, the government is able to obtain the necessary statistical data that will be analyzed to provide laws and regulations that mandate the need of generating herd immunity or in providing necessary laws and curfews. My role in the control and prevention. Firstly, mandating vaccinations for my workers. Here, when my workers are completely vaccinated, I provide an area of high immunity or herd immunity, which will also not only protect my workers, but also protect my patients. Purchasing the necessary medical devices. Now, these necessary medical devices are things like oxygen tanks, breathing devices, respiratory devices, etc. These are important in treatments of my patients to keep them healthy and safe and try to prevent death as best as possible. Purchasing the necessary protective gears. These protective gears are important for my workers as they will be using these protective gears, for example, the face mask, the gloves, to reduce the possibility of transmission from patient to patient. Providing training for my medical staff. Training is important. Staff need the training in order to know the regulations as to prevent possible spread. Assisting government in formulating important laws and combating possible community spread. Playing role as public health officer by providing information to the public. This is important because now I get to educate the public on the laws, the regulations, the rules they need to follow, which would also be important in the reduction of a possible severe outbreak of coronavirus within the society. My role in the resolution of the case as Chief Medical Officer, I will provide the testing areas for the public to determine the medical status, assist in creating necessary rules such as mandating vaccinations, curfews, and work hour schedules for different public areas, mask wearing, rinsing of hands regularly, and sanitizing of hands and other regulations. These implementations is important for the reduction in the case of community spread of disease and the possibility of causing an endemic or eventually pandemic. These resolutions are important in eradicating and preventing a grave outbreak within the society. And these are my references. Thank you for listening to my presentation.